Ngayong hapon, uunahin po natin ang update ng mga cases natin for COVID-19 sa bansa. As of 4 p.m. today, May 20, meron na tayong naitala na 279 na bagong kaso ng COVID-19. Ang total number of cases po natin ngayon ay 13,221. Sa mga bagong kaso pong ito, ang 150 or 54% ay mula sa National Capital Region at 14 o 5% naman ay galing sa Region 7. 89 po sa ating mga kababayan ay nadagdag sa mga nakarecover. Sa kabuuan, meron na po tayong 2,932 na recoveries. Kasama po sa mga nakarecover ay ang mga pasyenteng nakakonfine at mga pasyenteng may mga mild at positive cases and asymptomatic cases na nakarecover mula sa kanilang self-isolation at home quarantine. Ngunit ikinalulungkot po namin na 5 ang nadagdag sa bilang ng ating mga kababayan na pumanaw dahil sa sakit na ito. Umabot na po sa 842 ang kabuang bilang ng mga nasawi sa bansa. Para naman po sa mga updates on our healthcare workers, makikita po natin na as of May 19, meron na po tayong 2,315 na healthcare workers na nag-positive sa COVID-19. Out of this, nakapagtala po tayo ng 1,018 na healthcare workers na nakarecover mula sa COVID-19. Base po sa datos natin, paunti na ng paunti ang nakikita nating mga healthcare workers na nagpopositibo sa sakit na ito. Ang atin pong active cases para sa mga healthcare workers ay 1,264. Ibig sabihin, tumataas ang bilang ng mga COVID-19 survivors mula sa hanay ng mga healthcare workers. Masaya rin po naming ibinabalita na wala tayong bagong naitala na kapamilyang healthcare worker na pumanaw dahil sa COVID-19. Ang kabuang bilang po ng deaths among our healthcare workers ay nananatili sa 35. Inyo pong makikita sa graph na nasa inyong monitor ang patuloy na pagbaba ng mga bagong kaso ng COVID-19 sa ating mga healthcare workers mula April 11. Makikita din po dito ang pagbaba ng mga kaso ayon sa profesyon ng ating healthcare workers based on the onset of illness. Malaking tulong ang ating strict enforcement of infection prevention and control measures sa ating mga ospital at sa pagsisiguro ng kaligtasan ng ating mga frontliners. Tungkol naman sa kapasidad ng ating mga ospital, makikita nyo po sa inyong mga screen ang number of beds in our hospitals. As of May 19, meron na po tayong 13,356 total bed capacity na dedicated lamang po para sa COVID-19. Makikita nyo rin po dito kung ilan sa mga beds ay nasa ward, isolation at ICU. Para sa karagdagang updates, meron po tayong daily situational report released after this virtual presser which shows the latest numbers as well as the other initiatives and activities of the DOH in this war against COVID-19. Pagdating naman po sa iba't ibang equipment at personal protective na ating pinamimigay sa ating mga ospital araw-araw, makikita po sa inyong screens ang kabuang bilang at breakdown ng naipamigay natin kahapon. Sa atin pong emergency hiring program naman, kahapon nakapagproseso po tayo ng 177 facility requests for emergency hiring of additional healthcare workers. 6,374 ang slots na na-approve for hiring sa 172 na ospital, quarantine facilities, Philippine Arena COVID-19 Facility, and Quezon Institute Temporary Quarantine Facility. Meron na po tayong 2,505 na personnel na natanggap sa 168 na ospital at quarantine facilities. Nakapag-redeploy na rin po tayo ng 1,129 na nurses sa mga DOH at LGU hospitals sa ilalim ng Nurses Deployment Program. 178 na nurses sa Luzon at 951 sa Visayas at Mindanao. Heto po ang mga numero ng ating mga priority facilities accepting applications. You can send your applications directly to them. Para naman po sa pagpapahusay ng ating testing capacity, sa kasalukuyan po, meron na tayong 31 licensed laboratory sa buong bansa na nakakagawa ng RT-PCR tests. We are anticipating 89 more Stage 3 and up laboratories that have pending applications. Makakatulong po ito sa pagpapataas ng ating testing capacity. Ang buong listahan kasama po ng kabuuang bilang ng mga test na nasagawa natin kahapon ay makikita natin sa ating Beat COVID-19 Situation Report na ilalabas po pagkatapos ng programang ito sa ating website, sa FB page at saka sa ating Viber community. Bago po tayo magtapos, gusto po namin klaruhin kung anong wave at kung anong koneksyon nito sa flattening of the curve dito po sa ating sitwasyon ngayon sa COVID-19. Kasama po natin ngayong hapon si Dr. John Wong, miyembro po ng ating mga eksperto na nag-a-analyze at tumutulong po sa atin para mabigyan ng direksyon para sa polisiya at decisions ang kagawaran ng kalusugan. Doc, good afternoon po.
Good afternoon. Can you hear me?
Yes, sir. Loud and clear. Doc, maraming salamat po for accommodating our request for you to explain some matters to the public. So, Doc, I would just ask you one question and maybe you can further on and explain this issue that we have right now about the misconception on the waves of infection. Doc, can you please explain to our listeners and to our viewers, ito pong tinatawag nila na mga wave dito po sa ating sitwasyon ngayon with COVID-19 at yung misconception on the number of waves, first, second, third, and the other waves and the flattening of the curve, Doc. So, can you please explain it to us, Doc?
Okay, thank you. So we define outbreak waves as when there's a rising cases and then a decreasing cases. No? So it's like the waves of an ocean. There's a peak and then there's a trough. No? So for COVID-19 here in the Philippines, no, we have a very small wave last few days of January, no, maybe about 3 cases. No? And then there was a lull, no, very few cases after that. No? And then we had our second wave, which is the first major wave, no, of more than 10,000 cases. No? So this second wave peaked sometime in maybe end of March, no, at 538 cases, and has since gone down, no, to about 220 cases a day. No? So we're now in the trough, no, or the lower part of the wave of the second wave. No? So what we want to avoid is ECQ. No? When we shift to GCQ, that we would have another peak or several more peaks. No? So we have to try to postpone third or subsequent waves. No? So with regards to the flattening of the curve, what we mean by that is so the peak of the second wave was about end of March, no, and if we had not imposed ECQ just before that, no, this peak could have gone on, no, instead of just 500 cases a day, it could have gone on to larger numbers per day, no, but fortunately, the cases started to go down, and even though now, no, we still have some small peaks and also drops in cases. No, we're averaging about 220 a day. No? So the flattening of the curve occurred at about that time. No? After the peak of 500 cases a day, no? Instead of going straight up, no, we've been experiencing fewer cases. No? So we'll flatten the curve. No? When we say flatten the curve, no, what we actually mean is we flatten it in relation to our health system capacity, no, which is measured in terms of hospital bed, isolation beds, ICU beds, and mechanical ventilators. No? So if we keep below that capacity, no, that horizontal line, no, then we can say we'll flatten the curve. No? If we did not do any interventions, no, the line would have gone straight up, no, and exceeded that health system capacity line. No? So that's what we mean when we say that we've been able to flatten the curve, because right now, across all regions, no, none of the regions are in the danger zone, no, in terms of critical care services utilization rate. No. I hope that answers your question.
Yes, Doc. Dalawa po yung sinasabi natin dito, no? Ipapaliwanag lang ho natin ng medyo mas less technical sa ating mga nakikinig. So, ang una po nating pinag-uusapan ay yung wave na sinasabi natin. So, Doc, klaruhin po natin. When we say it's the wave or ito po bang tinatawag natin na terminology na wave, this is the number of cases, right? Yung tumataas na mga kaso.
Yeah, so a wave consists of a rise in cases and then followed by a fall in cases. No? So that's how we identify the wave. No? So in January, we had just a few cases. So these were the imported cases from Chinese tourists, or visitors. No? I think only about 3 cases. So it was a slight rise followed by a fall, and then it was very quiet in February, and then around first week of March, it started again, rising to the end of March, and then it started to fall again. So that's how we count the waves. First wave in the part of January, and then second wave in the first week of March.
Okay po, Doc. So ito naman pong sinasabi nating flattening of the curve, no? So lilinawin po natin. So nalinaw ho natin yung mga wave na tinatawag natin, ang mga pagtaas po ng mga kaso, at tinitignan po natin itong mga nangyayaring pagtaas at pagbaba ng kaso dito po sa ating timelines para nakikita ho natin yung progression nitong sakit na ito dito po sa ating bansa. Pero when it comes to flattening the curve, Doc, can you please explain again ng medyo mas layman, ito pong sinasabi na kapag ka po tayo ay nag-umpisa na, na pagpa-flatten ng curve, ibig sabihin, bumababa ang average ng numero ng mga kaso na nakikita natin o naoobserbahan base sa ating sitwasyon ngayon. Tama po ba, Doc?
Yeah. So when we say flattening of the curve, what we're trying to do is to prevent the number of cases from exceeding the capacity of hospitals to treat them. No? So a curve that is not flattened would exceed yung capacity of the hospital. No? So a curve that is flattened means instead of going straight up, it plateaus, it levels off. Could be level, could be decrease in number of cases, but the important thing is it never reaches or exceeds the capacity of the health system.
So dalawa po yung ating tinitignan, kapag tayo ay nakakapagbigay ng indikasyon na nagpa-flatten ang curve. Ang una po ay yung pagbaba ng mga kaso, of course, and of course we look at our critical care utilization na tinatawag natin, kung saan ito yung paggamit ng mga critical na mga equipment at saka of course isolation beds, ICUs, dun po naman sa mga facilities natin to measure yung ating kapasidad ng ating health system. So, Doc, tama po ba ako na masasabi natin based on epidemiological terms? Ibig sabihin, ito na po yung siyensya, We are considering na ginagawa po ng epidemiologist ang pag-i-interpret na sa bawat may mga kaso, may it be a small or a big wave, wave po ang tinatawag nyo dito?
Yes. No. So, the January set of cases was a small wave. It's a very, very small wave, pero since there was a rise in cases and then a fall, we still count that as a wave. Whereas the second wave, this is, you can also call this the first major wave, that we have, because it has a lot more cases than the first one. So more than 10,000 cases. So this is the second wave.
So yan, yan po yung pagpapaliwanag ng ating eksperto, si Dr. John Wong. He is an epidemiologist. Kasama po namin siya sa pag-analyze nitong pong mga nangyayari sa sitwasyon natin, specifically providing recommendations to the IATF para po sa mga desisyon na ginagawa ng ating mga cabinet members sa IATF. Thank you very much po, Dr. Wong.
Thank you.
Maraming salamat po, Doc. So bago po tayo magtapos, gusto lang ho nating bigyan ng konting synthesis, no, yung mga napag-usapan with Dr. Wong. Unang-una, in technical or epidemiological terms, we are already considered as being in the second wave. The first wave, according to Dr. Wong, was a minor one. At ito po yung nangyari nung January, wherein we had 3 cases and it was the peak already. And this was considered as a wave by our epidemiologists, though we only had 3 cases before. The second, but for us regular people, no, what counts would be the major wave. Hence, we are on our first major wave. The peak was last March 31, where we had 538 cases. And accordingly, sabi po ng ating eksperto, we had been flattening the curve in this current major wave, with the cases averaging 220 cases lang po in the past 5 weeks. No? So ito pong malaking indikasyon po ito dahil sinasabi ng ating eksperto that in the past 5 weeks, the average was only 220 cases. Kung saan, 5 linggo po ay matagal na rin na panahon, and this is longer than the incubation period of the virus. And the third, pinaka-importante na lagi ho naming pinapaalala sa inyong lahat, ang pinaka-importante po sa atin ngayon is ma-prevent natin kung anumang wave yung dadating po sa atin. If it's the second major wave at kung anuman pong pagtaas ng kaso, ang lagi po natin aalalahanin na lagi lang po natin gagawin ang mga sinasabi sa atin ng ating kagawaran ng kalusugan, ng ating gobyerno, practice hand washing, physical distancing, proper cough etiquette, wearing of mask, and regular disinfection. And of course, kapag wala naman pong gagawin, wag na munang lumabas ng bahay. You stay at home. If you are not part, dun po sa binigyan ng exemption ng ating gobyerno para sa panahong ito. So lagi nyo pong tatandaan na tayo po lahat is to remain vigilant. We cannot be complacent. We like to prevent the transmission. We like to end this pandemic. So para dun po sa lahat ng ating kababayan, sana po naliwanagan tayo ngayong araw na ito. Maraming salamat po sa inyong lahat. Mabuhay po ang mga Pilipino na patuloy na lumalaban sa COVID-19. Tandaan, together we can beat COVID-19.